Hi. So it's Belleruth again, and on with our continuing drama of how we started health journeys back 30 years ago on this our anniversary week of 30 years. So back again in the late 80s when I was encouraged to create more of these audios, especially now that I had a business partner. I was working on our first batch of 7 new guided imagery, illness-specific audio tapes. And I needed medical consultation on the medical side of things, how each disease behaved in the body, how physiologically it started, what it acted like on the cellular level, all stuff that I wasn't familiar with and that I needed consultation for. More than just looking it up in books. I wanted to talk to real people who had real experience with these conditions. But I had a horrible time getting any doctors to talk to me about this because they thought I was crazy. They didn't know me. They did not know me in a professional context. And it just was a very strange idea. Because if you're new to Cleveland, and few people know you in a serious context of being able to do things professionally, and it's over 30 years ago, and you say you want to create guided imagery audios to help people deal with stroke and diabetes and multiple sclerosis and cancer, it meant you were one of a few possible things. A, you were a channeling, crystal gazing, soul retrieving, out of body experiencing, parallel universe traveling, energy healing, new age Fruit Loop. That would be one possibility. Or B, you were a delusional alt-med revolutionary looking to take down modern medicine as we knew it. Or C, you were a bored dean's wife tired of giving a lot of parties with nothing better to do. Or D, all of the above. That's a bit of an exaggeration, but not so much as you might think. Okay. And there were other factors too that were typical of the time and the place that we were in. At that time, Northeast Ohio was a lot less conversant with the burgeoning research that was coming out of either coast or actually Texas that showed guided imagery was getting encouraging results with cancer and burn patients. And in some places, it was even considered an exciting new field. And additionally, what now gets called by the respectable name of integrative medicine, thank you very much, Andy Weil, MD, and Victoria Mazes, MD. Back then it was known as alternative medicine. Now think about the distinction and that word alternative. It implies instead of, or in competition with, medical treatment as usual. And providers did indeed fear that patients would be misled into thinking that if they used guided imagery, then they could throw out their pills, they could stop taking their insulin, they could refuse chemotherapy, and instead just try to think themselves well and die. So it was a threatening term, alternative medicine. And as I said, if I had been in a long-standing community of people who knew me and trusted me, much of the above might have been moot or somewhat moot, but I was a relative newcomer, and this was charmingly referred to actually as a trailing spouse. I'd left my professional identity and a decent reputation behind in Washington, D.C. to come to Cleveland. In Cleveland, I was in a bit of a pickle. Still, I really had absolute conviction that guided imagery was safe It was non-invasive. It was empowering to the people who used it. It was efficacious and a totally accessible solution for many varieties of misery. I had tried it out with my patients myself, and I had no doubt. So I cast about for ideas. I knew I just had to use whatever I had at hand. Like the psalm says, I lifted mine eyes up unto the street, from whence cometh my help. I lived on a street with a ton of doctors. And every Monday morning, we'd all politely eyeball each other, exchanging awkward pleasantries as we put out our trash on the tree lawn for pickup. I barely knew these people. They barely knew me. And besides, I was probably wearing a bathrobe and didn't want them to know me anyway. Nonetheless, I gathered my courage and shamelessly and relentlessly picked them off one by one, approaching each to ask if they would please let me pick their brains about some affliction or another that they had a specialty in. I think there was a rheumatologist, an allergies asthma specialist, there was a brilliant HIV researcher, and my kid's pediatrician, who was a rheumatologist, but also skilled in hematology oncology. Anyway, okay, so what were they going to do, right? They were trapped, and they knew it, because they had to face me on the tree lawn every week, maybe for a decade. So these guys, and yes, they were all guys, they were decent, they were certainly conflict averse, socially awkward, hardworking physicians who would have done their very best to avoid me under any normal circumstances. But because they were my neighbors and because we faced each other every Monday morning, they gave me their time and their wisdom. And they were very generous. They taught me a lot once we got going. Anyway, okay, so flash forward to now. By comparison, it just seems so easy to persuade a hospital or a health plan to use guided imagery with their patients or their members. Chances are they already know what I'm talking about, or they've seen or know about some of the research, or they don't have to worry about one of their peers mistaking them for a wacko channeling, crystal gazing, soul retrieving, parallel universe traveling, new age Fruit Loop. Those days, thankfully, are gone, and it's really much easier to say to somebody, hey, would you like to hear about this? It could be useful to you. Amazing what a few decades can do. And in the meantime, we must always continue to use whatever assistance is at hand, even if it means pestering people on your street. I heartily endorse it.